Everybody, Dr. Rob here, Facebook Live, Amazon #1 best-selling author, Inside Out Health, and ACA Sports Council Chiropractor of the Year 2015. I want to give you an update on what's new in concussion. As everybody knows, I lecture nationwide and worldwide on this topic. So we talk a lot about concussion and a lot about the gut-to-brain axis in reference to concussion. So there's some new articles coming out that are really expanding our knowledge on what's happening with concussion research, how to treat it, how to assess it, and really the educational component. One thing that stands out so much to me is the fact that only 1/3 of players, athletes, parents, and coaches at the high school level understand that a concussion is in the brain. So that speaks volumes to the idea that it does start in the brain as well, we know, but it speaks volumes to the idea that people do not understand the fact that what's going on, and that for us as practitioners, we need to educate everybody, and everybody who's not a practitioner, who has a teenager, a son, a daughter, a niece, nephew, etc., they need to understand that this is a legitimate injury. The literature is growing and it needs to be taken care of ASAP. Let's not sit on when someone gets a concussion. So to speak to that, first thing is, people who get a concussion are twice as likely to commit suicide than those who do not. Those studies were done for about 16,000 people. So that's very scary to me. We're reading so much in the area of football players and getting the CTE, chronic traumatic encephalopathy. Wow. And Steffi's laughing at me. It's one of those days. And in reference to the CTE, some of these athletes, I think 110 out of 111 of them had CTE that died, that were NFL players, really leading them down a path of possibly also wanting to commit suicide. So that really resonates with me. Very interesting to me is the brain. New target helps eliminate inflammation. Microglia. Microglia are those spinal cells in the spinal cord and in the brain that are essentially what we call macrophages. Macrophages are the captain of inflammation. So the ability to target the microglial cells and dim and not allow them to function, or if you will, to speak to the microglial cells, which are those macrophages, and stimulate them through nutritional, lifestyle, and laser protocols to enable those microglials to function for resolution of inflammation as opposed to perpetuate more inflammation. Huge takeaway here. So we want to dim the fact of inflammation. We want to resolve inflammation in the brain. Number 3, good quality sleep. There's nothing I can do. There's no supplement, there's no adjustment technique, there's no lifestyle technique that works if that patient does not sleep appropriately. Sleep is now going to be the conversation piece, or one of the additional conversation pieces of 2019 in functional medicine. Sleep quality is critical. Sleep is not only critical for what we talk here about, a better recovery from concussion. Sleep is critical for blood sugar. Sleep is critical to avoid weight gain. Sleep is critical to respond for memory loss, consciousness, musculoskeletal. But for today, good quality sleep, if you get good quality sleep, you're going to recover faster. Half the time, if you sleep appropriately, approximately 8 hours from a concussion. It was 14 days if you got good sleep versus 30 days in the particular study. Evidence of brain injuries in football players at a very young age. It's happening in 8 to 13-year-old group of children's preteens, and very, very young teens. So the real problem is these injuries are occurring. We've got to look for them. And the stats are really compelling to the idea of do not allow people before 12, it appears, to start tackling, because that seems to be where all they're getting the head injuries and the damage to their brain. Good takeaway here. Repeated hits, rather than one severe blow, are really leading to traumatic brain injuries, concussions. So it's a cumulative effect over a practice, over a season, versus the one hit. So take a look. Maybe, there's a growing sentiment on not letting kids tackle each other at practice, only in the games once they pass that 12 or 13-year-old threshold. Crash course, Stanford, Pop Warner. So Stanford University, for Pop Warner participants, is giving a crash course to the parents to understand the signs and symptoms of a concussion. So many times children show these symptoms and everybody says, oh, leave it alone, let them play through it, let's see if they go, it goes away. It doesn't necessarily go away. A symptom is a sign that something wrong in a system, and now you're talking about a system like the central nervous system that is involving the brain. So this crash course from Stanford University, Pop Warner, big takeaway. 1 year later, a third of the people had symptoms, and those symptoms were anxiety or depression. Well, how do you get anxiety and depression from a concussion? Well, this concept is, once again, the brain to gut or the gut to brain axis. They're a bidirectional communicator. The gut communicates with the brain, and the brain communicates with the gut. It communicates through the vagus nerve. To speak to that vagus nerve in 1/3, most of your anxiety and depression comes up from the gut to your brain. So when you damage your brain, you damage your microbiome in your gut, comes back and leads you down a path of anxiety and depression. So most people suffering from anxiety or depression really need to take care of their gut health. The brain damages the gut then communicates with the brain. It's bi-directional. Elevator up, elevator down to the gut, elevator back up. CDC did a great job. They just published children's guidelines in JAMA Pediatrics of September. There were 19 guidelines. Didn't want to list it for this Facebook Live. Those guidelines are great. Just Google the CDC's children's guidelines, JAMA Pediatrics 2018 September, and they'll come up. Concussion loosens insulation. The article really spoke to the idea of the myelin sheath loosened 2 weeks after a concussion. By loosening 2 weeks after a concussion, but it was 2 weeks. I want to emphasize that. It didn't happen in 1 week. 85% of people go back to playing their sport in less than 2 weeks. So what happened with this loosening in 2 weeks, people are already back, and yet the myelin sheath loosened. It takes up to 2 months for the myelin sheath to heal. So with that being said, concussions, you should probably keep people out, especially those kids out, a lot longer. So it's 2 weeks to loosen, 2 months to heal. Once you have a concussion, to go back in 3 or 4 days may not be appropriate, and you won't see those damage that occurred at the concussion right then and there. You'll see it much, much, much later. Don't forget, women are more susceptible to concussion. Women get them more commonly. They take twice as long to recover, and female soccer players are the #1 athlete that gets a concussion. Finally, the kickoff rule. I put that right here. Fewer concussions. There was a 69% decline in a concussion rate among Ivy League football players following a rule change. The rule change was very simple. They moved the kickoff line from the 35 to the 40-yard line, and they moved touchback lines from 25 to the 20-yard line. So the Ivy League switched a little bit. They didn't allow as much momentum. The hits weren't or as impactful, therefore not as much moving back and forth, not as much shearing. Remember, the brain is 3 pounds. It's made of the consistency of Jell-O. It's in this hard bone caused your skull. So what we're really seeing is it's not necessarily the impact of the brain against the bone. It's the moving and the tearing and the shearing. You can shear and tear your brain tissue up to 50%. Obviously, that's an awful lot, but it's easy to damage the brain because, again, the consistency is made of Jell-O. This is a brief update on what's new in concussion. I know we got a lot of questions. Anybody, any shout outs or anything like that?
Marvon.
How are you? How you doing? Great to hear from you. And we had some questions that they sent in, so let's go through those. Guys, ask questions. Feel free to reach out and ask some questions.
First question, where are you lecturing next on concussion?
I am lecturing next on concussion next week. Wait a minute, let me say that better. This weekend, Saturday and Sunday in Baltimore, Maryland for Aconia. So if anybody wants to come, we're talking a lot about concussions. We're talking a lot about the gut-to-brain axis and laser therapy. So you can come this week, go to aconia.com. We'll have a big party over there. We've got a great little crowd. Baltimore right on the waterfront. The week after that, I'm in Vancouver, Washington. And 2 things to look for in 2019 are the Integrative Health Symposium. I'm actually talking about the microbiota gut-to-brain axis in health and disease. There's a component of concussion. That's February 22nd in New York City. And all throughout the year, the Florida Chiropractic Association.
Next question, which wavelength laser light do you recommend?
The wavelength laser light. So the wavelength laser light to heal the brain, the one that I like is the red light, which is 635 nanometers. My choice of laser is the Erchonia FX635. To stimulate the vagus nerve, which I alluded to before, I like the 405 wavelength, which is the violet light. So, of course, I'm a big proponent of laser therapy post-concussion. So I like to laser the brain with the 635 and again with the violet light 405 to stimulate the vagus nerve. Got some real advanced vagus nerve techniques. So if you can catch a seminar, or maybe we've got a webinar where I'm going to do a Facebook Live. It is December 4th. I'm doing that with Erchonia and Sean Bean. You're going to love that. When I'm in Vancouver, Washington, I'm with Diane Southwick.
Okay, give me your top 5 supplements for concussion.
I will give you the top 5. So great question. So basically everybody wanted the protocol. So protocol number 1 is you want to take care of the musculoskeletal system. When it comes to concussion, we don't look at the musculoskeletal system. We only look at the brain. The musculoskeletal system, we should be looking at the neck and other areas. So the muscle in the upper part of the neck that's most compromised in the occipital triangle is the rectus capitis posterior minor. That's the one that has the biggest myodura ridge. We need to look at the neck and look at the neck to try and mobilize the neck because the head is on the neck. Of course, we want to do a whole bunch of balance training. Visual disturbances are very common, so we want to do some gaze stabilization. We just spoke about laser therapy, so I'm a big proponent of using the laser therapy, a multitude of different wavelengths with different devices, and nutrition. Now, with nutrition, I'll talk about the supplements. Number 1, not in any order, but here's my top 5, and then I'll break them down. Fish oils, omega-3 fatty acids, specialized pro-resolving mediators, magnesium L-threonate, glutathione, and maybe surprising some people, sulforaphane. So let's go with the omega-3 fatty acids. Omega-3 fatty acids, in a nutshell, have been shown to help and enrich the cell membranes, and that's a critical element. The membranes are damaged. A very fluffy membrane from a lot of omega-3s really enable you not to get the kind of damage. The literature has shown post-concussion you can recover 75%, in some studies up to 90% of the tissue damage by taking a high level of omega-3s, which is 6 grams and or more. What's really great about omega-3s, everybody please make note, is if you're playing a contact sport, you should be taking them every day because they enable you to avoid the concussion. So with that, to speak to that, what you want to do is you should be taking 2 or 3 grams of omega-3s every day. DHA, critical element, EPA and DHA, great ratio. Number 2, specialized pro-resolving mediators. They are the nutritional component that enables you to resolve inflammation. So they enable you to resolve inflammation because they have a switch, a lipid class switch for macrophages. That lipid class switch tells the macrophages to slow and end the inflammation. So it causes what we call a homeostasis between initiation and resolution of inflammation. SPMs are a breakthrough. Thank you, Dr. Serhan, for recommending those and creating that next step after omega-3s. SPMs, fish oils, very different, should be taken together, very synergistic. Number 3, magnesium L-threonate. The studies are robust. Magnesium L-threonate is a critical element, 2 grams, studied MIT, 2016 September study came out, showed that magnesium L-threonate decreased brain aging by 9 to 14 years. It made a large amount of bioavailability of magnesium in the brain and in the blood cerebral spinal fluid. So that's a critical element, really good to help you avoid Alzheimer's. L-glutathione, essentially love glutathione. It's the master antioxidant, decreases brain tissue damage by 70%. And sulforaphane, it's a critical element. You get it as long as you chew and don't cook broccoli or chop it. Sulforaphane has really shown to help with the NRF2 pathway, increase this antioxidant pathway, and also stop the release of MMP9. MMP9 damages the basal lamina in the blood-brain barrier. So those are my top five nutrition. There's others.
Okay. What foods should you avoid after a concussion?
Well, you are more susceptible to inflammation after a concussion. So the big foods are obviously going to be gluten. No gluten. Shouldn't be before, but certainly not after. Sugar. Sugar is maybe the biggest culprit. Sugar is a big culprit because your brain doesn't really function well on sugar. Trying to avoid dairy, nicotine, artificial sweeteners, and you want to start to consume much more good quality fats, omega-3s, avocado, olives, coconut, and the like. So you want more of a ketogenic diet post-concussion because your brain really functions better on fat than it does on carbohydrates. So clearly afterwards you want to fuel it right, and fat and ketone bodies are a critical element to fuel the brain appropriately. Get any other questions?
That's it.
That was it? Okay, guys, do me a favor. Like, click, comment, share it. Stephanie wants me to let you know. Please, we've got a great YouTube channel. It's pumping out really big. It's drrobertsilverman.com. The same thing on our Instagram. Take a look at that, drrobertsilverman.com. We're going to do a Facebook Live this weekend on site with all our chiropractic brethren out in Maryland. Well, hope to hear from you. Let me know if there's anything you want me to cover. Dr. Rob, always yours in health.